Once again, hello, Miss Dex64. This is Buddha Nature once again here. This is the second video reply that I made to you. This one's going to be a bit more detailed. In my previous video, I mentioned to you how to find the right doctor, how to find the right dentist. This video reply is based on your video Snap-on Smile Update Toothache. Now, you mentioned several things in your video. In this video, you mentioned how the Snap-on Smile was fabulous for you, an aesthetic fix, but that doesn't solve your underlying oral dental condition. And you also touched on how you're not ready for dentures yet. You mentioned also at the beginning of your video that when you were a child you were taking some medications that discolored your teeth. Usually that would be, I believe the antibiotic name is tetracycline, that discolors teeth. At least that's what they taught us in a dental profession, and I work at a dental office. That's what I do. And you also mentioned how you were picked on, so that it became kind of like a trauma for you, being picked on by other people and children and whatnot. You're not alone. There's a lot of people that are currently suffering from tetracycline staining from taking this medication as a child. And most of them do have to pretty much undergo almost the same things that you do, and they have to endure through all of that. However, now that the damage is done and you're looking for options out there, I do have to mention that anything that I mentioned to you in this video is for the sole purpose of education and not diagnostic or medical advice or anything like that. You know, just a disclaimer in the video, but for educational purpose only. You strongly mentioned in your video how you are, or you have dental phobia, and that's perfectly normal. It's okay. And usually those patients that go to the dentist and they have dental phobia still, especially at your age, is because they're not comfortable with their dentist. You have to find a dentist that will ease your fears, and even after trying for some time, if the fear is not relaxed or if the fear isn't removed, then there are a lot of different options out there for you, such as conscious sedation, enteral sedation, nitrous oxide, and IV sedation, or just plain out general anesthetic for a dentist who has hospital privileges to just knock you out. You know, you go to sleep, you wake up with something in your mouth. But you mentioned that you weren't ready for dentures. Generally, with people with your condition, different things are recommended. Let's touch on the endodontic therapy or root canal that you were concerned about. Well, when you have a root canal, some doctors let you know that there's a 50-50 sometimes success rate. It may work, it may not work, and sometimes it has to be retreated. It's cheaper to have a root canal done by a general dentist, generally, than an endodontist or a root canal specialist. Because, you know, they have the special instruments for it, they have the microscope, and, you know, they're able to sterilize the canals with better visibility sometimes, all of that good stuff. But a root canal doesn't necessarily mean it's going to cure everything for you. I hate to say this, a lot of people may disagree with me, but a root canal is a temporary solution also. It just buys you time. But eventually, the blood supply to the tooth, or the vital pulp of the tooth that keeps the nutrients flowing into the tooth and keeps it alive, the root canal, what does it it kills that, it eliminates that, so your tooth is dead in your mouth. So with time, the tooth may fracture, abscess may reoccur on the tooth, and you mentioned sinuses. You must have really long roots. Sometimes, generally, the roots of the teeth are so long that they're in your sinus. Sometimes they have to be removed if they're infected, because that infection may spread throughout the sinus or affect the sinuses, and may develop into future problems for you, other than just teeth problems. So here's what I've seen clinically recommended over the years for patients with your condition. If most of your upper teeth are missing already or they are damaged, usually they recommend for you to have all of the upper teeth removed. All of them. That means you will have no teeth in the top. I've seen in some of your videos where your lower teeth are still present. I don't know how healthy they are or not. That's something that your treating dentist would have to determine with you. But after you get the top teeth removed, full arch of the top removed, or the extraction of all the upper teeth, you would do some implants on the top. Sometimes 2, sometimes 4. And then what you would do is you would attach a denture to those implants. So the denture becomes a fixed prosthetic. That means that you don't take it out and in. So essentially it's a denture, but it is anchored in the mouth by those implants. So it's like putting the denture on the implants so that it's permanently in there. Another thing would just be just a full denture that you would take in and out without the support of the implants. That would be another option. But then again, that's up to your treating dentist. And you would be doing all of this perhaps under sedation. The anesthesia costs, it's an extra fee, it's an extra procedure that requires your doctor and your I guess dental assistant or the nurse who's going to be helping the doctor monitor you. So it's a lot more involved, where they have to constantly check your vital signs, make sure that you're doing well during the sedation, all of that. So it's an extra service, an extra fee. Excuse me. So I don't know your age, but usually in what I have seen in this demographics here in the state of Texas, here in Houston, where I practice here, we have patients at this age. We recommend dentures. If they have healthy teeth, we recommend other options to anchor something on top, like a bridge or things like that. But the way that you're mentioning, what you're mentioning is that you have very little upper teeth left. And you have to come face to face with reality. This is a problem that you have to get fixed. It's causing you pain. It's deteriorating your quality of life. It's taking precious time from you, if you put it that way. Pain, we're not ourselves when we are in pain, because our thought process, is different when we're in pain. We just want the pain to go away so we can get back to our lives. So maybe you can ask your dentist if you're a candidate for implants. Not everyone is a candidate for implants. That's another thing. People with diabetes or other medical conditions may not be candidates for implants. So it's just something that that you have to think about. And if you're going to invest a lot of money, do it on a long-term investment, on something that you don't have to constantly be changing, or something that inevitably in the future that is going to come out, like a root canal. I've seen root canals go on for anywhere from a year to 15 years to 20 years. It all depends on the individual. That's another thing. Treatment varies from person to person. Not everyone has the same body, not everyone has the same toleration to pain, not everyone has the same prognosis to a treatment. So the prognosis for a root canal for you may not be the same for another person. Oral hygiene plays a vital role in all of this as well. So I think that my video, and I hope that my video has helped clear some of your questions. And like I said in my previous video, if you have any questions regarding dental treatment, I can provide you with answers on an educational basis and not as a treatment option or a treatment plan or anything like that. And you know, that privilege is only between you and your doctor. So I can help you with educational information that may, you know, help you clear some questions up. But finally, this informed decision that you're going to make on your treatment should only be between you and your dentist, and the law requires that. So I wish you luck. I am sorry that that at this point in time you are going through dental misery, because dental pain is something that you can't get around unless you actually do seek treatment. You know, you can only take painkillers for so long. You can only take antibiotics for so long. Eventually you have to seek treatment. You have to seek the services of a licensed dentist. I wish you well, and I hope that whatever decision you make is in the best of your interest. And until then, please keep us updated through your channel. Bye-bye.